We have Dr. Erica in studio with us this morning, and we are talking about chronic cough. So let's start off with the basic. When do you know it's something you should go to a doctor and talk about?
Right. So, today we're talking about the cough that is not a dangerous infectious cough. So if you have a fever, if you have chest pain or shortness of breath, or certainly if you're coughing up any blood, or if you're having any appetite changes or unexplained weight loss, you need to go and seek medical attention. So today we're going to talk about the other stuff, the people whose spouse keeps telling them that they continue to cough and it's annoying and they need to go to their doctor and get something done about it. And there's kind of a process that we as medical providers think through to determine what the cause of that chronic cough is. The first thing that I think of is postnasal drip or allergies. That's probably the most common cause, where people have mucus that's dripping down the back of their throat from their nose into their throat and making them cough. Sometimes this happens while they're sleeping at night, and then they wake up in the morning and have to clear their throat and they cough up a bunch of stuff, and then it happens again or during the day. I think the best thing that you can do, and this is over the counter now, is a steroid nasal spray like fluticasone or Flonase. It can also be obtained by prescription. Nasonex, Nasacort are similar ones. And what I like to tell people about this is it's 2 sprays each nostril, but straight back. That's a big mistake a lot of people do. They think because it looks on our face that our noses go straight up, so they spray it straight up. It really just hits the ceiling and drips down and doesn't go where it needs to be. So straight back towards your ears, and then it will aerosolize where it needs to go, and that can help with the postnasal drip. If that doesn't do it, or you just want to try a pill instead, those non-sedating antihistamines over the counter can sometimes help with that as well, but the nasal spray does a great job. If that doesn't seem like that's the problem, I always think about heartburn or GERD or reflux. And a lot of people are surprised by this. Actually, I think Ed said he was as well, and it had personal experience with this, where acid reflux creeps up your esophagus and trickles over into your lungs. This happens a lot when people lay down at night, especially if they've eaten anything close to going to bed at night, or if they just suffer with heartburn and reflux anyway. And so just try, now we have over the counter as well the Prilosec and Prevacid and the Nexium as well, and see if that works over a few weeks, if that can help the cough. Also, not eating right before you go to bed, giving it a couple hours, keep the head of the bed elevated, sleep on an extra pillow so that acid doesn't trickle up and spill over.
All right. Well, Dr. Erica, thank you so much for joining us this morning. We do appreciate it. Go get checked out if it's just not something normal.